Well, school's back in session, which means a lot of dust and dirt will be kicked up into the air. If your child or if you're a teacher and your child suffers from allergies, or if you're a teacher and you suffer from allergies or asthma, this can be kind of a frightening time. But here to talk it all through and how to mitigate the problem is Dr. Reena Mehta with Uptown Allergy and Asthma. Dr. Mehta, good morning and thanks for being with us.
Good morning. Thank you so much for having me.
So let's break down back to school allergy mitigation into three categories. Let's first start off with the fact that, kids, teachers heading back to class and they haven't been in these buildings for a long time. So how should they prepare if they already know they have allergy issues, especially when it comes to asthma?
Great question. So I know my kids started school today, so it's the exciting start of the school year. And of course, we want to keep our kids in school. So as healthy as we can keep them is the most important key. So if you know that you are an allergy and an asthma sufferer, I think the number one thing is being aware of what triggers you. So whether that is pollen, dust, mold, and if you're not sure, this is the best time to visit with your allergist so that you can understand what your triggers are and come up with a good action plan. So an action plan comes up with basically a list of medications or understanding what you need to do to treat your symptoms. So if it's allergies, whether that's a nasal spray or an antihistamine, and if it's asthma, better understanding what you need to do every day in terms of medication and when to seek help. If you're starting to feel like your asthma is uncontrolled, when to go see your doctor.
And the other thing you and I got a chance to talk about was not only are kids going back into school, dealing with dust and other, agitators they haven't been dealing with while they've been out of school. We're also entering, you mentioned the respiratory viral season. So I guess the other question I have for you is, how do parents and even a teacher, if this is something they deal with, tell the difference between an allergy issue or one of these viral respiratory infections?
Exactly. So it's the fall and all of these things are creeping up. Allergies, respiratory viruses, RSV, flu, COVID is still there. And so better understanding the difference of, am I sick with the virus or is this my allergies and what do I need to do? So I would say that a lot of the symptoms are the same. The runny nose, the sneezing, the coughing. The difference is typically it's a virus that presents with a fever. Allergies do not present with fever. The other differentiating factor is allergy medication. So typically allergy medications are not that helpful for a virus, whereas they can be very helpful for the itching, the sneezing, the runny nose that you see when it's due to allergies.
That's a really good point there, that medication tip. The other big thing kids might have or teachers might have is issues or allergies when it comes to food. How do you prepare when you're going back in an environment with all kinds of different people who eat all kinds of different foods and they're around you?
Exactly. So this is the best time to be proactive. With the start of the school year, this is the best time to communicate with the people that you're around. So obviously, if you're a student, parents making sure that the teachers are aware of what their child's food allergies are. The school nurse is aware of what the child's food allergies are, and the cafeteria where they eat lunch. Having an action plan for food allergies is imperative. You have to have that. You have to have an action plan that says what you're allergic to, and you should be bringing your emergency medications to school. So that would be things like an EpiPen in case there was a severe reaction, and Benadryl for a more mild reaction. But the best thing you can do is to make sure everybody around you is aware of what your child's allergies are so that if the situation comes up, they know how to intervene and treat it.
And the biggest thing, Dr. Mehta, for kids who are not yet back in school, for those who are back in school, it's still the early days, it's to have conversations with parents and nurses and school staff and cafeteria workers, even as you mentioned, to prepare for the rest of the school year so everything goes smoothly as we move forward, right?
Exactly. Every environment is different. So just because you've been in the school before doesn't mean that classroom is the same. So you may have different triggers. Maybe your child is going to college now and they're going to be staying in a dorm room. So understanding that every new environment can bring on a whole new set of triggers and being aware that this could be an issue and then tackling it when it comes. And then if you're not sure what to do, that's a time to see your doctor, especially your allergist.
All right, Dr. Mehta, some really good tips as everyone's heading back to classrooms and college campuses across the country and here locally in these next few days. We appreciate your time this morning.
Thank you so much for having me.